chemotherapy and radiation are two different treatments. Some cancers respond really good to chemo, some respond really good to radiation, some they combine them. And at one point they were actually thinking that she would do chemo and then radiation. But as it progressed, they said, no, the radiation on her won't work because the tumor was so large. They said it would be like a nuclear bomb going off. That's how much radiation she would need. And so they said radiation won't work because it's very localized, small amounts. And hers was so big that the radiation wouldn't help. Chemo treatments are different because there are some types of cancer that you come in for a treatment. So you would go to the clinic, they hook you up with a port or an IV, and they run, it's like an IV, but it has chemo in it, different kinds of medications, and they run that through, and that's your treatment, and you're able to go home after a few hours. I don't know if you're lucky to have that kind, because then you have to go home and you're throwing up and you're sick at home, and then you have to come back again and do another treatment of chemotherapy. With her, because she had to be hospitalized because she had to be up every 2 hours to urinate, and she couldn't miss it. They had to have her up, and the type of chemo that she was getting had to be run. It wasn't just one treatment. It had to be run over 3 days worth. And she was getting 2 different medications. And so they would run one, and then they would switch and run the other, and then they would switch and run back to the other one again. And they had to do that over the whole period of time. So she had to be in the hospital that whole time to have the chemo run. She had all kinds of side effects from it. Nausea, vomiting, things. She completely stopped eating. She, even things that she liked to eat normally, when she wasn't sick, she wouldn't eat them anymore because she associated that with being sick. Even now, if I take her into primary children's, she says it's making me nauseous just from the smells, because she associates that with the chemotherapy making her so sick. She also, at one point, her immune system was so low that she developed a fever, and she got really sick, and we had to come back into the hospital and have IV antibiotics run. And she was in the hospital for another week running just straight antibiotics that whole time, and she was on oxygen. Her hair fell out from the chemotherapy. We were really surprised at how quickly it actually fell out, because she had only had the one round, and her hair started coming out in clumps, just big sections of it. And after it coming out, after a couple days, she shaved her head off because she couldn't handle the hair coming out anymore. She was really fatigued all the time, really tired. Even when she was having a good week, she was just extremely tired during that whole time. Didn't do a lot of anything. She had, her teacher would come from her school and was doing homeschooling with her so that she would stay up with her class. And an hour, her teacher would come for an hour and she'd sleep the whole time after that, because that was just too much on her. She did really well, though. She actually, she didn't lose her eyebrows or her eyelashes until her 5th round of chemo. And then her eyebrows started falling out. And so she thought that was kind of funny that she was completely bald, but she still had her eyebrows and her eyelashes. The hope is that it's killing the bad cells and not the good cells. Unfortunately, chemo kills any fast-growing cells, and that's why your hair falls out. And sometimes you'll get like cankers in your mouth because there are fast-growing cells inside your mouth. You'll get sores and things, and it's because it's killing any of the fast-growing cells. And because cancer is fast growing, the hope is that it will kill the cancer, but unfortunately the side effects is that it also kills your hair cells and kills your immune system. Your immune system drops really low and you have a really hard time fighting off just normal colds and things. So there are different kinds of chemotherapy depending on the type of cancer. Some are more effective on different kinds of cancer. One of the ones that she was on was actually radioactive. They would dress up, it had to be covered at all times. They would dress up head to toe in gowns, gloves, couldn't be anywhere near her, change things without gloves and full things on in case they got any of the chemical on them. Even when she would urinate, they'd have to wash everything completely because it was passing through her, and they'd clean everything out and make sure that there was none because it is radioactive. She was on.